It is the middle of the night. I guess technically Sunday morning. I did talk to my hepatologist on Friday. The video visit did go through, and she's actually, on meeting her for the second time, she's really personable and nice. I really liked her. She didn't have a lot of time for me. I think it was my friend Heather went with me because I was talking to my boss this week. I was having a hard time, and my boss was asking me, well, who goes with you on these visits? Because as the patient who is going through this for the first time, it's probably too overwhelming to be expected to remember what to ask and to remember everything that is said. And I thought about that for a few days, and so I called Heather. I think it was like a half hour before the appointment. She had already said earlier that she was willing to go with me to Zoom in or whatever was needed. And I wish that I had given her more notice, but she was available. And she was willing to do it. And so we came up with some questions. I was talking to another friend, and I got some questions from her. And so we waited for a little while. She was 5 minutes late, no big deal, the doctor. And I asked about branched chain amino acids and CoQ10, and she says no supplements. She's like, if your doctor says to take it, then take it, but she's not going to recommend anything, no supplements, until I start getting the symptoms, especially with the branched chain amino acid. She said if I were starting to get the encephalopathy, she might suggest it, but not as a prophylactic or anything, and same with CoQ10. I have an order to get my blood drawn, and I guess there are UCLA labs all around, so I don't have to go down there every month or two. I'm gonna have to get my blood drawn every month or two, at least for now, which is fine. I'm super okay with that. Draw it as often as you want. I want to know what's going on. I don't want to be in the dark like this all the time. I don't like getting my blood drawn. I'll probably do it next weekend. I don't like it. I don't want to do it, but I have to do it. So the more often the better. And if it starts costing me a lot of money, though, we might have to make it quarterly, which is also fine. So I'll look into that this week and get the appointment or whatever ready and go do that. We're going to follow up in 3 months, so I've got some time. And I should have it done before I see my gastro, too, so I'll have that to take to her. I don't know how to get her on the team, if she even wants to be on the team, or if she just wants to follow me separately. I have Heather's notes, but I don't have them pulled up, so I just have to try to recall as best I can. I didn't remember to ask about clinical trials or new treatments. I did let her know that I consult Dr. Google, and I apologize because I'm sure doctors freaking hate that. So, and I let her know, I do read papers, and I do I think if I had to say what she got from this, she hasn't done notes yet, or at least I haven't seen her notes, but what I think she might take from this is that I'm very motivated to keep on top of my health now. But I did have some questions about being on the list. I asked about my MELD score since it's 17, and that's around the threshold. What happens if my MELD drops below? And she didn't come out and say straight ahead that they're just not going to take me off the list. What she said was, it's something we just watch, and sometimes people get better and they're on the list, but they don't need to be on there. So I extrapolated from that is that I'm not just going to be like dropping. I'm going to be on the list. Like that's unless some miracle happens and I reabsorb the scar tissue, the fibrosis, right? You know, I get a regenerative factor. A freaking radioactive spider bites me, whatever. But I think the implication is once you're on the list, you're on the list. Once you're sick enough to be on the list, you're not getting better. And the other question with that was if I had to decline a liver for any reason. I couldn't ask the question the way it was presented because I can't just ask the doctor, like, oh, if I decide I don't want to do it that day, do I lose my spot? So I said if I'm sick or if I'm traveling or something, and she says, no, I'm not going to lose my place. She didn't go into whether or not there was like a penalty or if I could eventually drop off the list for doing that, but she just said let them know, which is fair. So, guess I didn't really get the question answered for my friend. I mean, it was relatively fruitful. She apologized for not getting the blood work, but to me, the blood orders to me, but, like, I understand. I don't have a sophisticated understanding of how hospitals work, but just on the patient side, going there the few times I have, it's a madhouse. It's like a clown car. You just can't imagine how many people are there. They're busy. They're just busy. So, you know, I am not one of your more sick people. I am not a priority, and I don't expect to be treated like one. So, like, if I fall through the cracks every so often, yeah, okay. When I need something, I can get it though. So it's been a while to get to this place. I had some pretty desperate moments there. I like my hepatologist, like, on a personal level, and I like that she's young. I like that my gastro is young. I think that I need people who are more on the cutting edge of medical science, or people who are at least willing to, like, my gastro absolutely does research. Like, I think I'm a learning experience for her, and I think that's great, because you give me help and I provide you with, knowledge for your future for other people. It's all good, all on the board, all across the board. Yeah. So my next doctor is my gastro. That'll be next month, I think, early-ish. Then I have my PCP in July. I have an ultrasound in August. Yeah, the hepatologist said that I'm due for an ultrasound in August for cancer to see if I have developed HCC, which is liver cancer. And then the lipid clinic in September. They're not going to accept a video visit. I got to go. And I think I got to go up there for the ultrasound too. So hopefully I can call Nurse Legate and, whoops, please don't, whatever. I can call my nurse and maybe get them scheduled closer together or not. I don't want to be a big problem again. I'm not a priority. And truthfully, I don't want to be. I like where I am. I'd like to stay like this as long as humanly possible. Alright, well, thank you for watching. I'm feeling better enough that I think I can come back to being a little bit more consistent. I'll talk to you later.